Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Okay, so as I mentioned at the start of the show, we had Jason who wrote it and said, what do you recommend for anxiety-related disorders, Dr. Grand-Pichet?
Yeah, so Jason, while I'm answering that, I'd love to know if anxiety is a comorbid issue or it's just purely you're asking about anxiety. In other words, are we talking about someone who has ASD and anxiety, or are we talking about just anxiety? The reason I ask is that ASD tends to make things a little bit more complicated, right? Because then I need to know kind of the level of understanding and processing and functioning of the individual who also has anxiety. Having said that, it is really common for people on the spectrum to experience anxiety. And it makes total sense. I've actually, Shannon, we have several shows in the past and recordings and talks I've given about this subject because I feel very strongly that some of the things that we see in autism is actually just like symptoms of anxiety. And I'll give you some examples of some of the things that might cause the anxiety. And basically then if you can try to deal with those things, they will definitely help. Now, as I said, as I was answering the question before, there's also professional help for anxiety, right? You can get on antidepressants. Anxiety and depression have the same exact medication. There are some medications that are meant for acute anxiety, like panic attacks, and those types of things are, will help temporarily. But long-term medication like selective serotonin reuptake inhibitors, SSRIs, or SNRIs. These are all for depression and anxiety. They help both. Now, it really does work. And thank you. I just saw Parker's comment that, Parker, I appreciate that. I'm so glad you did that. And that's just awesome that it's working for you. And I gotta say, it takes the edge off, right? And it just really helps. Medication does help. But you want to also make sure you're trying to figure out what's causing the ongoing anxiety. Sometimes it's just trauma, right? Like we just talked about. It's something that has happened and now you kind of like your whole mental health has shifted and you sort of need to work on that. Sometimes it's just ongoing stress. A lot of times, a lot of us like at work or we worry about our kids or work or some other thing. And the same goes for our kids. They might be anxious about going to school because they might think that, someone's going to make fun of me or I'm just not going to get it or whatever it is. And if that is the case, you need to help them figure out how to have support and strengths in that environment that's causing them anxiety. So for instance, if it's a child who's really worried about their ability to perform at school, let's help them. Let's give them tutoring at home that will help them become a stronger student. Or maybe you want to get some behavior technicians who will help the child know how to socialize better so that when they go to school, they're not experiencing the same level of social anxiety. Other causes of anxiety, especially on the spectrum, we're looking at things like sensory sensitivities, right? I mean, imagine if you were constantly being overloaded, your senses were being overloaded by too much light, too much sound. I don't know about you, but when I am exposed to a very chaotic, loud environment, and especially if I'm tired or I've had a long day, it will absolutely evoke anxiety in me. And I kind of feel like I got to run away and just isolate myself, right? So sensory input is a big one that causes anxiety for our kids. And I think giving them ways to calm themselves or regulate themselves, like noise canceling headphones. A lot of times for our kids, we will set up in the corner of a room a really giant bean bag with a noise canceling headphone and their favorite music there, and they can just, whenever they feel themselves getting all riled up, they'll go to that area, sit in the beanbag, put on their music, maybe look at a book. Ways to calm down. Um, and that's a whole nother, lecture on, there are so many things that we can teach our kids to do for relaxation and for self-regulation. And it really starts, Shannon, with just identifying that you're about to get anxious, figuring out what are the things that are making me anxious, and how do I give myself more love right at that moment or in that setting or environment. That isn't true. That is not just for our kids on the spectrum, right? It's for all of us. If we could identify the situations and scenarios that make us really uncomfortable, and we just make sure that those situations have a higher reinforcement level, right? More people supporting us, more love, more any kind of, like, tutoring or preparation, then we're going to make it through that. And the last thing I wanted to say that really contributes to anxiety is lack of sleep. And a lot of our kids, of course, don't sleep. And a lot of us, parents, don't sleep. And sleep is probably one of the most important things you can do for yourself and for your child, no matter what you do, to receive that sleep. It's the time when your body and your mind heal. And so if your child is struggling with sleep issues, write into us. We can talk a lot more about sleep. But, these are all the different things that you can do to try to kind of support your child or yourself, if it's you're talking about here. And anxiety is something that we are able to conquer. So, if you do all of these things, things will get better for sure.
I just want to say that last week, Dr. Grant Pichet and I participated in a global conference in Arizona through the Autism Society of America. I believe you can still get tickets to it because all of the presentations were recorded and you can watch them for a couple of months. And Dr. Grant Pichet did a talk, and I participated with her on, the title of it was "What Am I Missing?" And there were different parts of the talk where it talked about anxiety and where it talked about sleep and a whole bunch of other issues that maybe you hadn't thought about. And with each one, we gave a PowerPoint with resources. And for the anxiety one, some of the best resources that we have, Dr. Grant Pichet did a 2-part series. We called it The Anxiety Show. You can find it on YouTube. I particularly, if you can't watch both hours, watch part 2. Because in part 1, she gives you the whole history of the diagnosis and what autism has to do with anxiety. But in part 2, she kind of recaps that very quickly and then gets into all the different things that she just talked about and more. So both of those resources are available to you guys. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.